For being here. We're going to be talking about something that I think you're going to hear a lot more about in the future. And I think therapists are using AI will be at an advantage. We're just going to hear a lot more about artificial intelligence. So what I asked here was to provide precision counseling by creating a treatment plan using AI. And so I said, give me evidence-based treatment plan for an adult client with the following personality and mental health symptoms. And as you see them here, some of the 5-factor models I listed was high conscientiousness, high in neuroticism, moderate in agreeableness. I didn't add the other ones. Enneagram 8, because we're hearing a lot more about Enneagram using personality assessment, Myers-Briggs and ISTJ, from a Native American culture with symptoms of panic, depression, and social anxiety. And in just a couple seconds, the AI system generated this treatment plan. And I appreciate that the very beginning statement is talking about how we need to collaborate with clients in order to treat a treatment plan. So I like that that's the very first statement. And then I look through here and they list CBT. Well, that's clearly an evidence-based treatment. They actually get specific, like teaching cognitive distortions and how to correct that using exposure therapy, particularly with social anxiety. Okay, that seems very evidence-based. Mindfulness techniques, absolutely, that's evidence-based. Teaching things such as deep breathing, meditation, progressive muscle, absolutely. They also listed that if they're unresponsive to behavioral therapy, to consider medications. I think with anybody with mental health should be evaluated by a medical doctor to look at blood sugar and thyroid functioning, liver functioning, all that kind of stuff. But they also were precise enough to say, hey, SSRIs and SNRIs medications are typically what would be used with anxiety and depression. Cultural, they say to ensure cultural sensitivity by integrating Native American cultural values and practice into therapy. Well, absolutely, we want to do that. With the Enneagram, it's funny because they did mention it, and they said, hey, you need to incorporate this stuff in counseling, but they weren't as precise as I would like with that. And I suspect as they update these systems and AI is gathering more and more data, they probably will. However, they were a little more specific with MBTI, with the ISTJ, talking about how individuals with that type of personality like to value structure and order, so that it may be good to have kind of structured interventions like cognitive distortion sheets or worksheets and so forth. They have an ethical consideration to maintain confidentiality. They also taught, there's a lot of stuff I didn't include here, but that assessment should be continuous. There's just a lot of good stuff. And then at the bottom is that they're saying, hey, with a true treatment plan, we should be working in collaboration with a licensed clinical mental health counselor or licensed therapist. So I think that this is just going to grow stronger and they're going to provide even more precise treatments. But what I would like to do with this is to work with a client and say, hey, what personality characteristics would you want me to put in here? Of course, you're not putting the client's identifying information other than this. And what symptoms would you want me to put? And then both of you, after generating the report, and again, it's just a couple seconds, can go through this and then decide what might be the best starts for treatment and what makes sense and what doesn't. So I think this could add some validity to the work that we're doing in the profession. And it definitely, there might be some stuff I might add here, but when I'm looking at CBT, mindfulness, including cultural information, possible medications, and personality stuff, this is doing a lot of work for us. So let me know your feedback on this, and we will talk to you on the next video. Take good care.